Good evening, my name is Joseph Lonikin, and this is Family Medicine. So, interviews and peer presentation. This interview was taking place via email and in person with Lynn Folks. The interview was done on March 20th of 2025. This presentation was given on March 20th, 2025 at the Second Family Inc. office. So, let's begin. Whoa, you decided to go down the path of medicine and you're wondering, what's next? You know it's going to be many years ahead of you, and there's lots of information that you have to learn and lots of skills you have to adapt to while being in family medicine. So you're wondering, how do I start all this and how do I go down my path? Well, let's start with the basics of the span of medical education. So, while in high school, you can get involved in internships, apprenticeships, and shadowing opportunities to boost your hands-on experience and skills in the medical field. This will also elevate your chances of getting into a college or medical school. Once you graduate high school, you can enroll in an undergraduate program and complete all medical prerequisites. This means you can go to a 2-year community college or a 4-year university and complete all medical prerequisites. Most medical schools require you to get a B or higher in these prerequisites to be eligible enough for their medical school. Now, once you're a sophomore or junior in college, you are going to take your MCAT. An MCAT is a computer-based examination where you're tested on your critical thinking skills, problem solving, writing skills, and biology and chemistry skills. These are all examined to determine who is the best medical student for the medical school. After this, you want to apply and attend a medical school to become a doctor of medicine, an MD, or a doctor of osteopathic medicine, a DO. Once you're in medical school, you want to complete an intern year and family medicine residency, which is 3 to 5 years. Your first year of family medicine residency is your intern year. During this year, you're going to be learning how to do lots of different examinations and taking care of worldwide patients. You will be dealing with normal family medicine physician circumstances and workplaces, and this will help you get ready for the future ahead of you. Now, after you've completed all of these requirements, you'll get your specialty board certification. This is an acknowledgement award to show off all the skills and learning that you've achieved throughout your medical education. Now, after medical school, you want to get into a fellowship. A fellowship is a specific type of training you get for a specific medical career. In this instance, for family medicine, you can go to a hospital or private care in order to get started in your fellowship. Now, here's the work, lifestyle, and financial implications. While there are many steps and trials to following the path of medicine, it also comes with multiple beneficial factors and disadvantages as shown above. Our first beneficial factor is job security. Job security is the security you get inside your job to make sure you do not lose your job or place inside your job. This means that you'll be able to work where you want, how you want, and where you want inside your job as a family medicine physician, because our job is high job security. Now, another beneficial factor is variety and work variety, right? Variety, it means that while you're inside your job, you'll be able to get loads of different types of patients from different cultural backgrounds, illnesses, diseases, etc. Meaning that your work isn't day-to-day tasks that get monotonous. While those are some beneficial factors, here are some disadvantages. One disadvantage is work-life balance. As Lynn Folks has mentioned herself, it is very difficult going through college and learning different family child care aspects because it costs many hours which have to go into your hobbies that you want to pursue outside of your job. Now, along with this, there's the cost. Medical school can cost anywhere from $160,000 to $250,000. Now, here comes the salary. The salary is a beneficial factor, as the salary for a family medicine physician can average at about $190,000 a year. Now, as you get better at your job and more skilled, you can earn more money as your pay raise increases. Now, here's the career satisfaction. Career satisfaction basically means the burnout levels of your career. And family medicine physicians have the lowest rate of burnout out of any job in the medical field. This means that throughout all these beneficial factors and disadvantages, they're the happiest and most mentally stable in their job. Now, here's the demand and occupation outlook. Physician employment will grow 4% from 2023 to 2033. The aging population, chronic illnesses, and increase in demand for mental illness will only increase this growth. But by 2037, the Health Resources Service Administration, HRSA, projects a 27% decline in family physicians. This means that if you are interested in this field currently, now is the time to pursue, as there will be high job security in the future, and we are currently losing a lot of family medicine physicians right now. So, in order to boost the inflation of this job, make sure you get your hands on the material as fast as possible. Now, here's the importance of primary care and preventative medicine. Our mission is to be more people-oriented. This means that caring for people isn't a task, but it is a job that we take upon ourselves. We care for these people just as much as their peers or family do, meaning that we want to know what is going on so we can prevent any illness or disease as much as possible. And to do this, we need to build a patient-physician relationship. This means that we need to be able to communicate and simplify the medical care process to these patients in order to understand their chronic illnesses and understand their cultural backgrounds and where they come from. As I said multiple times, we deal with a plethora of different patients all around the world, from different ages, different backgrounds, all of that. So we need to be able to adapt to all patients' needs. We won't be able to cure all patients' needs, but being able to prevent with medicine is our goal. Being preventative means that we are able to stop the illness or disease that is harming your loved ones as soon as possible, and to get to know you. Now, here are some of the career options inside family medicine physician. First, we have the hospitalist. Next, we have the med spa, working in the ER, pediatrics, and dermatology. Inside family medicine, there is 20 plus careers that you can choose from, but here are the top 5 that most people go into. Now, our question here is family medicine right for you? You want to make sure that you know your core values and what makes you want to be in family medicine. Does it align with your goals? Is it who you want to represent in your life? And does it show who you want to be? Do you care for people as much as a family medicine physician should? Now, a brief story of our interviewee. This is Lynn Folks. Miss Lynn Folks loves family and child care, as she describes her favorite age range to be from 4 to 6, as she realizes the rising and quickly development in their cognitive and physical behaviors. Along with this, Miss Lynn Folks attended University of Illinois to study finance and majored in child education. This is how she became a preschool teacher inside Crofton High School. Miss Lynn Folks currently hosts and directs all of the preschool inside Crofton High School. And along with this, she was able to get accredited through a program in Crofton to become MSDE accredited. Miss Lynn Folks describes her job as a 10 out of 10 because she's able to care for those of our future society and make sure that they get the learning and development that they need to be successful in their lives. Thank you. Here's my resources.